Hello everyone, happy learning. In this video we will discuss about a hidden danger to your joints called avascular necrosis, AVN. That is a condition where your bone tissue literally start dying from lack of blood flow. And AVN can cause stiffness, joint pains and bone collapse if untreated. And AVN can badly affect the joints, especially you can see here the hip joints. This is commonly affected by AVN, and if this is left untreated, it can lead to bone collapse. This is really dangerous. So first we will understand what is AVN. Here you can see avascular necrosis. Avascular means without blood supply or lacking proper blood flow. Necrosis comes from the Greek word nekros, meaning death. So here we have death of blood tissue often due to lack of blood flow or injury. So in AVN we have tissue death due to lack of blood supply. If blood supply reduced, for example, due to trauma, steroid use, alcohol, the bone in the femoral head may not get enough oxygen or nutrients, and over time this causes the bone to weaken, collapse, or die, leading to AVN. AVN is also called osteonecrosis, means that a part of bone dies because it is not getting enough blood flow. Just like plants need water, our bones need blood to stay healthy. When blood stops reaching a bone, that bone tissue slowly dies, causing pain and joint problems. You can see here most commonly affected areas we have hip joints, knees, shoulders, anklets. Next question we have, what is bone tissue? So bone tissue is the living part of your bone. It is made up of cells, blood vessels and minerals like calcium. It looks hard from the outside, but inside it is alive and active. Just think of your bone like a tree. The outer part is strong and hard, like bark, and inside part is softer and has cells that grow, repair and make blood cells like the tree sap and core. So, bone tissue is what makes your bone grow, stay healthy, and heal when injured. Without enough blood flow, bone tissue dies. This is what happens in AVN. Loss of blood supply to bone tissue leading to bone death. And this commonly affects the hip joints, and it can also affect knees, shoulders. Here you can see the causes of AVN. AVN can happen for many reasons. Some people have no clear reasons, but here you can see common reasons includes injury or any trauma. A broken bone or joint injury can damage blood vessel or reduce blood flow. Next, we have long term steroid use. So, medicine taken for long time can lead to AVN, and drinking too much over time can harm the blood flow to the bones. And some diseases like HIV can also cause AVN. And different therapies used in cancer treatments like radiation therapy, chemotherapy can also cause AVN. Other reasons we have blood clotting disorder and cholesterol using certain medications. Here you can see different symptoms. Here we have different AVN symptoms: pain, stiffness, joint pain. In the beginning, people may have no symptoms, but over time, people start experiencing pain in the joint, especially around the hip joint, and at first only with activity. Later, when AVN progress, person can experience pain even at rest. So we have different symptoms like stiffness that reduce movement, limping, leaking or grinding in the joints, weakness in the affected area. Now we have different diagnoses of AVN. So doctor use different tests to find AVN. First we have X-ray that may show the damage in the later stage, because in the early stages this is not clear in X-ray. Second we have MRI, that is the best test. MRI clearly show the early AVN before X-rays. Next, we have CT scans or bone scans that we can use to see the damage more clearly. And other blood test. Now we have the treatment of AVN. So here treatment depends on how early the disease is found and how much the bone is damaged. In early stages, we have non-surgical options like rest, avoid putting pressure on the joints. Now we have AVN of femoral head. AVN of femoral head means that the top part of the thigh bone, which fits into the hip joints, is not getting enough blood, and this causes the bone to slowly die. Now let's try to understand how blood normally reaches the femoral head. So here we have main blood supply. So here you can see the main blood supply comes from two arteries. These two arteries wrap around the neck of the femoral head and form a kind of ring. From this ring, small blood vessels go directly in the head of the femur. Now let's try to understand how AVN is developed. First, we have impaired blood supply, means the blood is not flowing properly to certain part of the body. When the flow of blood is reduced, blocked, or slow, the tissues may become damaged or start to die if the problem continue. In simple words, we can say when bone does not get enough oxygen, so bone tissues dies, leading to pain, and if untreated, then bone collapse. Next, we have bone schema. That is the starting point of AVN. It is like bone is suffocating without blood. Like we humans suffocate without oxygen, here bone is suffocating without blood because blood brings oxygen and nutrients that keep the bone cell active and alive. If blood flow stops, bone cells begins to die and bone can become weak. Third, we have osteocyte death. So osteocyte is a type of bone cell. The bone cell have died usually because it's not getting enough oxygen and nutrients, often due to poor blood supply. Last stage we have collapse of bone structure. It means the shape and the strength of the bone break down, usually because the inside of the bone has died and become weak. Inside your bone, there is strong and spongy structure like honeycomb, but when bone cells die due to lack of blood, the inner structure becomes weak, brittle, easy to crack, unable to hold weight. Eventually, the outer surface of the bone caves in or flattens. This is called collapse of bone. In the hip joint, AVN of femoral head, the round top part of the thigh bone starts to flatten or cave in. This lead to joint pain, loss of smooth movement, arthritis, and sometimes permanent disability if untreated. So sign of bone collapse, we have sudden bursting of joint pain, difficulty in walking or standing, limping, and even at this stage, X-ray or MRI can show the bone deformation. AVN would not heal on its own. Early treatment can save your joints. So that's all about this video. If you have any questions, you can comment below. And thanks for watching this video.